recording. Okay. So how is everybody doing for Monday of week 2? You made it through week 1. How's everybody doing?
Doing all right. All right.
Okay. That's good to hear. I'm sure last week was overwhelming. Getting introduced to all your new classes and your syllabuses and your modules. So hopefully you have taken some time to get things organized with all your classes and get everything on your calendars. There's a lot to put on your calendars. If everybody could turn on their cameras, please, I would appreciate it. Okay. First of all, I wanted to introduce Dr. Kapteros. Some of you may know her from previous classes. Dr. Kapteros and I will be co-teaching this class along with a double section class on Friday. Okay, so for the next couple of weeks, on the Monday class, she will be observing the class. And then going forward, we'll be alternating teaching. I'll be teaching the Monday double section and she'll be with me. And then she'll be teaching the Friday double section. I'll be with her. So what will change for you is, or the way it will work is I'll be teaching this Monday class, but there's 2 sections. We have a section 3 and a section 5. Dr. Kapteros will be taking over the section 5 class with regards to grading and tutoring and reviewing, meeting with her. So I wanted to introduce Dr. Kapteros. Would you like to say anything?
Hi, and I'm excited to start this class, and I recognize quite a few of you, and nice to see you at the end.
That's awesome. That's awesome. Okay. Don't try, well, your quiz should be accessible now, but don't try and access it just yet. So real quick, I have gotten a few emails this morning from students in the Florida campuses with regards to the impending hurricane coming. Okay, students asking me about, and this obviously doesn't apply to us today because we're all here, but classes later in the week, other classes later in the week. So my response has been, I am sure, obviously the priority is everybody remains safe, right? That's the priority. I am sure there's going to be communication. No, you don't need a second device. I am sure there will be, pending any changes with cancellation on campuses or classes. I am sure there will be communication coming out with regards to whatever the guidance is going to be for all of us. Okay, that's all. I don't have any emails or communication with regards to any campus closures, any canceled classes. But I would anticipate that that communication will be coming out over the next couple of days. Does that help? I mean, for us today, we're okay, right? But I think things are gonna be a bit challenging over the next couple of days with weather forecasting and all of that. So let's all wait. Let's all wait for communication to come out as far as what the plan is. Does that help with any questions anybody might have? Okay. Okay. So the way we're going to do it today is we're going to take the quiz now. Don't open it yet. Myrna, since you're sitting in on the class, you don't have access to the quiz. Okay, so you're just going to have to, you can stay on after class and I can explain why that's the case. So, so we'll take the quiz and then I spend actually a lot of time reviewing the quizzes with you. And that's because I put rationales in the quizzes and you'll see those. as you go through the quiz. Okay, I do a lot of my teaching from the quiz rationales because a lot of the concepts are introduced in these quiz questions. Okay, so we'll review the quiz, review the rationales, and then we'll go back through all of my notes and do some additional detail with each of the concepts. Okay, and this will take the whole class because we're covering 2 weeks, right? We're covering week 1 concepts and week 2 concepts. Okay, does anybody have any questions about that? So for all of those of you that have tried to access your quiz before now, I need you to refresh. Okay? There is an access code to get into the quiz, and I'm going to put that in the chat. It is my last name. Okay? So don't get started just yet. Just a couple of tips, okay? You need to stay on camera. You need to stay on camera during the quiz. Once you're finished the quiz and have submitted it, you can go off camera until we're scheduled to come back, but I wouldn't log off, all right? Because remember that attendance report gives all that information when you logged on, if you logged off. So just stay logged on, but you can certainly go off camera, okay? It is 3:07 now. The quiz is timed for 15 minutes. All right, if you finish before, that's fine. Go off camera. So I'm going to say 30. That's what I'm getting to, Keel. Hang on 1 second. So 2:07, or let's say 3:10, 15 minutes to 3:25. Okay, so if you finish early, if you can be back no later than 3:25. How does that sound? We will get going at 3:25 again. So go ahead, refresh, get started on the quiz. You don't need to let me know in the chat when you're done. I can see that because the grade populates right into the grade book. Okay, so go ahead and get started. I'm going to mute myself. And to prevent any distractions, if you have any questions, please put them in the chat. Okay, is everybody able to see the quiz? Yes? No? Putting in the access code. Okay, so I'm getting lots of thumbs up, so I know it's working. Okay, so I'm going to mute myself, and any questions, please put in the chat and I'll answer those. Okay, good luck. Take your time. You have 15 minutes. If everybody could start coming back on camera, I would appreciate that. How'd you do?
Could have did better. I went back and forth on a couple of them. I wish I
Okay.
wouldn't.
Okay.
I could have did better.
Did you,
I
most of,
got a 9, so I feel like I did all
oh,
right.
great, great. Did you take advantage of the concept recordings that were sent?
They was decent. They was a help.
Thank you.
Oh,
Okay.
you welcome.
All right, let's take a look at the quiz. Did you all see
Rationales
the,
was nice.
pardon me?
I said the rationales was pretty nice too.
Yeah, how do
Little
you
long,
like
but
those? How do you
nice.
like the rationales? So if you got
They
the
nice.
question
They
correct or incorrect, you still have the same rationale. I started doing that last term. I felt like it was a good opportunity to I felt like it was a good opportunity to give you an understanding of the question. And again, like I said, you don't have a rationale on yours. Did some have rationales and some not? Did ever,
I had rationals, but I
I
do
had
have a question
rationales.
about one of
All
the
of them, I
tests.
think.
I
pardon
had
me?
rationals.
You all had rationales?
Yeah.
Except it doesn't look like Alexis had rationales. I'm not sure why. They're uploaded into all of them. So Alexis, if you want to stay on after, we can try and sort that out. So anyway, when we get to exam prep, one of the things that I will ask you to do as part of your exam prep is always go back and review the quiz rationales from the exam for the weeks that we had quizzes leading up to the exam. So for example, this week and next week, the quiz questions, the content of the quiz questions and the rationales all apply to exam 1. So please use the quiz rationales because the quiz rationales come from a lot of the teaching notes that I use. Okay, so make
I do have
sure.
a question about one of the quiz questions though,
Okay,
because
can
I
we
felt
wait?
like it could have been.
Can we wait till we get there and then you can bring it up, Jory? Okay. But again, I started doing the rationales last term and I received very positive feedback from students that they were helpful. And again, you can always go back and review them as well. But definitely for exam prep. So let's see, let me check the chat. I have 4. Okay. Let me go ahead and share my screen. And we'll
Hey, did you, before you share your screen, did you check my message?
and who is speaking?
Johnnisha Johnson?
I didn't check the message.
Okay. Because I was having like some internet connection issues, so I wasn't able to log on to like 15.
Yeah, why don't you stay on after Janisha, okay?
Okay.
All right. Hey, can everybody see my screen?
I'm gonna run a
Yes?
Yes.
Okay. All right.
Yes.
So in your readings and in the concept recordings, what did you learn about the difference between community-oriented nursing and community-based nursing? What is the difference?
Community-based is
Community-based
focused
is to
on
help educate the community.
Okay, we do that in both. What's a significant difference
One is
between
that you're talking to the client and one that you're talking to the community. I mean, one you're talking to a direct
it's
patient,
for the
one you're talking to the
community and one
community.
is for individuals.
correct?
Yeah,
Let's look,
I got it
let's
mixed
look,
up.
let's look at the rationale. Okay. So community-oriented nursing is focused around the whole population. Okay. It's primarily focused on health promotion rather than illness care. It's a whole group rather than individuals. So I think of it as, think of yourself orienting yourself to the community as a whole. Community-oriented nursing. Community-oriented nursing also is synonymous with public health. Think of public health nursing, where they're looking at the whole community or the community as a whole. Okay, so before I even get to the answer here, I just want to go through these two. Community-based nursing, on the other hand, you think of it as you are based in the community. Okay, so you're taking care of clients, it's individualized care in the community. So if you look at the rationale, community-based nursing is a setting-specific practice where you're providing care to sick individuals or families where they live, work, or attend school. So a community-based nurse would be a school nurse. A community-based nurse would be a hospice nurse. A community-based nurse would be an occupational nurse. You're working with clients in the community.
Right.
Okay, the emphasis is on acute and chronic care and the provision of comprehensive, coordinated, continuous care. Right, so community-based nursing, again, emphasizes acute and chronic care to individuals and families rather than focusing on groups. Okay, and what we mean when we say groups is the population. So if you look at these answers, there's only one that's community-based, right? And that's B, educating the child and school teacher on the use of an inhaler, right? You are based in the community. Here, it would be a school nurse. But if you look at the other three answers, they're all examples of community-oriented nursing, where you're looking at the community as a whole or certain populations within the community. So developing a teen pregnancy prevention program, educating the outcomes of a community vaccination program, providing diabetes education prior to hospital discharge. These are all examples of community-oriented. Okay, does that make sense? So I think of community-oriented is the big picture, orienting yourself to the community. Community-based, you're based in the community, taking care of clients in the community. Okay. Question number 2. Hopefully, one of the required readings for week 1 was to click on the link and go into the Healthy People 2030 campaign. What did you think of that website? What did you think about when you were reading about Healthy 2030?
I feel like I looked on the website. I feel like it was like okay, but I looked at your recording and the other professor recording, and I kind of feel like I got a better understanding of it because,
Okay.
like, basically, y'all both stated like it's the well-being of everyone, like it's
Everyone.
like basically
Every-
like all the whole population is based on
Exactly. Well, interestingly enough, if you read through their website, Healthy People 2030 actually started out as Healthy People 2000, and then it went to Healthy People 2010, then it went to Healthy People 2020, and now we're at Healthy People 2030. So these are ongoing goals and objectives, right? They're national objectives. And the intended outcome is to, and I'm looking at the rationale now, is to improve the health and well-being over the next decade. Okay, and they are a set of objectives for everybody, not a specific population. Okay, so if you read through their website, these were their 5 overarching goals, and I've listed them here. And if you look at them, you can see that they are geared towards everybody. Attain healthy, thriving lives and well-being free from preventable diseases, disability, injury, and premature death. That applies to all. Try to eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being for all.
I'm in class.
Somebody needs to mute, please. I would appreciate that. Thank you. Create social, physical, economic, and economic environments that promote attaining the full potential for health and well-being for all. Like Janisha said, these are objectives for everybody. Promote a healthy development, healthy behaviors, and well-being across all life stages. And then one of their other goals is to engage leadership, key constituents, and the public across all different kinds of sectors to try and design policies that improve the health and well-being for all. So the key to Healthy People 2030, one of the keys, it's designed for everybody. Okay, so knowing that, A would be the answer, right? Providing the framework to improve health for all Americans. Everything else is specific, right? It doesn't establish guidelines for treating the most common chronic illnesses. It has nothing to do with a nursing curriculum. And it changes the focus from community health to individual health. That's not true either. Okay, so A was the clear answer, improving health for all Americans. Does anybody have any questions on that? Which is true regarding uninsured and underinsured individuals. I covered this particularly in my week 1 concept recording. Okay, so this is really an introduction to vulnerability. All right, so let's read the rationale first. Okay, we know that vulnerability, and this came from your readings, has many aspects. It often comes from the feeling of lack of power, limited control, victimization, disadvantaged status, disenfranchisement, and health risks. Okay, members of our vulnerable populations may have multiple illnesses with each affecting the other. Right? Some of these people do not succumb, in all cases, to health risks. And it's important to help them develop resilience. And resilience is another question later on in your quiz that I went through in quite a bit of detail in my concept recording. So how do we help vulnerable people? Nursing interventions should include strategies that will increase resources for these vulnerable populations or individuals. Try and help them reduce the health risks to decrease the health disparities between vulnerable populations and their counterpart, which is the populations with more advantages. So one of the risks of being in a vulnerable population is either being uninsured or underinsured. So just think about that for a second. If you are uninsured or underinsured, what is most likely to happen? Why is C the correct answer?
Because you're less likely to see preventative care.
Exactly. Exactly. So if you're underinsured or uninsured, you may not have the access that you need for preventative services. So therefore, you don't get preventative services. So when you finally show up at the clinic or the ER or the urgent care, whatever you have going on is likely more advanced. So if you think about it, look at A, you are more likely to attend preventative wellness visits. That's actually incorrect, right? You are less likely to develop preventable diseases. Actually, you are more likely to develop preventable diseases. And then D is actually the opposite. They're less likely to need government health resources. Actually, you're more likely to need government health resources. So just think about if you are working with clients that are uninsured or underinsured, what are the risks? Okay, well, Janisha said it. Right? You don't have adequate access. Therefore, preventative care doesn't become a priority. Does that make sense?
Yeah.
Okay.
I have one more question. Can you
Sure.
check your message one more time, please?
You know what? Can I do it after class? I'm in the middle of class. Can we meet after class?
We can. I feel like this one is kind of important though.
Okay. Okay, I'm gonna have to stop sharing. Hang on.
I'm sorry.
It's okay. No, because you'll have a different quiz.
Okay. 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 I want to just make sure. I want to be like,
Yeah, no.
all right.
Well, okay. So when we talk about vulnerability, this was in your readings and this was in my content recording. Which clients likely belong to vulnerable populations? We know that veterans are vulnerable. We know that substance abusers are vulnerable, irregardless of their age. And we know that people with HIV, irregardless of their age, are vulnerable. Okay, why is A incorrect?
That's the one I picked too.
Well, think about it. Why is
It's not adolescent.
Because it's not a teenager.
correct? Who said that?
Me.
Rebecca, that's exactly right. A vulnerable population with regards to pregnancy is considered teen pregnancy. Teen pregnancy is a vulnerable population. We don't consider every pregnant person vulnerable. I mean, there may be some pregnancies that are vulnerable if you're not a teen, but all pregnancies are not considered vulnerable, but teen pregnancies are. So the reason why A is incorrect is because of the age. Okay. D is, or A, B, C, D, E is not correct because we don't consider every STD to be a vulnerable population. It is issue, but it's not, pardon me? It's not considered a vulnerable population. Okay, so the correct answers were B, C, and D. Okay,
Damn.
so, pardon me? So, does somebody have a question? I heard hang on. Okay, let's take a look at the rationale for this. Vulnerability is defined as susceptibility to an actual or potential stressors that may lead to an adverse effect. Vulnerability to poor health does not mean that some people have personal deficiencies. Rather, it results from the interacting effects of many internal and external factors over which people have no control over. For example, a person may have some biological limitations, including genetic risks, made more severe by pollution, lead-based paint, excessive noise, other external factors. Vulnerable populations are those groups which have an increased risk for developing, pardon me, adverse health outcomes. And in your introduction to vulnerability page in your module for week 1, all these groups were identified in that reading. So the next question talks about resiliency as it affects vulnerability. Think about what is resiliency? What's resiliency?
Being able to bounce back.
Pardon me?
Being able to bounce back.
Being able to bounce back. Anybody else want to add to that?
Yeah,
I have
I
helping the
got,
population.
Pardon me?
Helping the population.
Okay.
what I got was, this was straight off you though. It was like when you're more resilient, you're like less likely at risk. And then like the less you are with the resilience, you are more at risk,
Correct.
like greater risk.
Right. Resiliency is the ability to fight back, the ability to overcome. Right.
Yeah, like
So,
confidence, all of that.
exactly. So one of the interventions we will try and use in working with vulnerable populations throughout the community is trying to increase their resiliency. Right? Always working to try and increase resiliency. Because the more resilient you are, the correct answer is A, the more resilient you are, the more that reduces your vulnerability to certain risks. And if you look at the other 3 answers, it's just the opposite. Okay, resiliency increases the likelihood that somebody will get sick. No, it decreases the likelihood, right? The more resilient you are, the less likely you may become sick. Resiliency does not depend solely on genetic predisposition. Okay, resiliency cannot be learned if a client does not possess it. Yes, it can. That's one of our roles as a nurse, is to try and increase resiliency for our vulnerable populations. Okay, and my rationale explains resiliency in more detail. Right? Resiliency is influenced by early life experiences, negative events in childhood that aren't dealt with through counseling or other approaches can decrease resiliency. So when you have higher levels of confidence, it increases your resiliency. Okay? So those who feel the locus of control is internally doing well, right? Do well. Those who feel that they're trapped or feel helpless and don't have a lot of resilience, those are our populations and individuals at risk. Okay? So what do we learn from resiliency? That's what we help our clients develop. Because we know in the long run, the more resilient you are, the better able you are to identify your risks, work with them, deal with them, find the resources necessary to deal with whatever you have going on. Okay, so resiliency is important. Okay, this question comes from week 2, this is school nurse section. Okay, which client, which child should the school nurse care for first? What's the critical word in this question?
Off
Mm-hmm.
Pardon me?
and unable.
Now, what's the critical word in the question?
First. Yeah, first.
First.
This is a
First.
priority question. Okay, by priority question, I mean there is a word, a phrase, a cue in the question that needs to jump out at you. Okay, so this question is asking what is first? Who do we care for first? Okay, and in a lot of your quiz questions and your exam questions, there are going to be priority words or phrases or cues that you're going to have to be able to recognize. You know, who do we care for first? What is the most important? What is the least important? What do we do last? Those are all important words that you need to recognize. So, does everybody understand that B is correct? Because it's not that all of these 4 kids will not get cared for, but the question is asking, who do we need to care for first? Who is in an urgent situation that we need to go to first? Okay, so the 9-year-old complaining of a cough and unable to participate in physical exercise class, what is that? What is that indicative of?
Like
Airway.
asthma, airways.
Asthma, can't breathe.
Asthma.
Exactly. Exactly. This is an ABC question, right? It's not that the 7-year-old with a rash does not need to be seen. Somebody 13-year-old with burning excessive tears. Okay, we'll take a look at that, but not right off the bat. Right? And a 15-year-old inability to focus because of missed medication. Of course, we have to deal with that child. But the 9-year-old complaining of a cough, unable to participate, that's potentially an indicative of an impending asthma attack, difficulty breathing, airway issues. How many of you picked up the word first in that question? And we're looking for something that was safety related. Let's look at the rationale. The rationale pretty much gives you an overview of school nurse. Okay, the different roles school nurse has. Okay, and I can speak with this from direct experience, being a school nurse for over 20 years. I functioned in all of these roles. Maybe a direct caregiver, okay, providing care for illness or injuries, overseeing self-administration of medication. Okay, for me, take that a step further, catheterizing, replacing trachs, trach care, suctioning, inhalers, EpiPens, emergency seizure medications. Okay, big role in the school nurse is direct caregiving. Another role of the school nurse is health educator, providing information about growth and development, puberty, substance abuse prevention, hand hygiene, acute illness prevention, diet, exercise, obesity prevention and treatment. A lot of health education with the parents, with the students, with the teachers, with the administrators. Okay, consultant, providing health information to teachers, school administrations, and parents. Yes, you do work as a consultant. It's always important for the staff in the buildings to know what kind of health issues they have going on with their kids. How many kids do we have with asthma? How many of those kids with asthma have inhalers in the clinic? Maybe in high school, how many kids are carrying inhalers on their own? Who has EpiPens? Who's a type 1 diabetic? Where's their insulin located? Do they have a pump? Or do they have insulin in the clinic? You as a consultant for that school, you need to make sure everybody is aware of what health issues you have going on in your schools. Case manager. We'll talk about case management later on in the term, but basically a case manager is the coordinator of care. That's what a case manager does. Right? So in the schools, you manage the kids with the complex chronic illnesses. Right? Kids with G-tubes, what time are their G-tube feedings? What time do they have to be cath? What time do they go to PT, speech, behavior therapy? As a school nurse, you will be a case manager coordinating those complex kids. Okay. And then certainly community outreach. As a school nurse, you may participate in health fairs. You may create health fairs. You may put together immunization clinics. Okay. A lot of community outreach and working with the community for school nurses. Okay, the next question gets in again to week 2 to some of those, all the different childhood ailments that you went through. And this one has to do with iron deficiency anemia. So which food should the nurse recommend with a child with iron deficiency anemia? Why is eggs the correct answer? What did you learn in your readings? High iron foods, right? So what about iron deficiency anemia? Okay, this rationale gives you an excellent synopsis of it. But with regard to this question, what food, I'm going down here to this bullet here. Okay, high iron foods. Liver, red meat, egg yolk, dark green leafy vegetables, dried fruits, dried beans, fortified cereals, and breads. Okay. Okay, this was in your diabetes section. Okay, school nurse notes a dark discoloration along the neck crease and the armpits of a child. Which steps should the nurse take? Okay, what is that indicative of? What are the dark discoloration along the neck crease and armpits? What can that be a symptom of?
Diabetes.
Diabetes. Okay, if you look at your rationale, children can have type 2 diabetes and rates in children, the rates are rising for kids and adolescents for type 2 diabetes, right? We know that the rates of diabetes are higher in ethnic minorities, including Hispanic, African American, and American Indians. Okay. So what is this called? What is this called when you have the discoloration along your neck crease and in the armpits? Acanthosis nigricans. Okay, that's what it's called. Okay. If you think about it, if a child presents to you with this, the first thing we would do is advise parents to obtain a full medical evaluation, since this can be symptoms of prediabetes.
What's wrong?
Right? We wouldn't be evaluating the scalp for excoriation marks, reminding the child to use the cream, recommending iron rich. We don't know what's going on actually, right? All we know is that we're noting dark discoloration along the neck crease and armpits of the child. So we would encourage the parents to obtain a full medical evaluation to see what's going on. Okay. Which nursing intervention is a priority for a child experiencing a developmental delay?
Can you look at my lap?
Pardon me? Lead exposure. That was another common childhood ailment that we talked about, or that you read about this week. Okay. One of the potential symptoms of lead exposure is developmental delays. Okay. So A, you should have picked based on your readings. All right. So which nursing intervention is a priority for a child experiencing developmental delay? Right. Another question. What is the key word in this question?
Developmental delay to me.
Oh.
Intervention.
Priority.
Priority.
Oh, yeah.
Priority. Right? It's not that some of the other answers couldn't be correct, but you're looking for the priority answer. And here's a good quiz and exam test taking strategy. If you get to a question that's not a select all that apply, okay, and you look and see that maybe one or two or maybe three answers could be correct, but it's not a select all that apply, what should you do? Go back and reread the question and see if there was an important word or phrase in there that you didn't pick up the first time around. Right? So for example, this is a good example of that kind of question. It's asking for the priority, what intervention is priority. First, we would want to evaluate the environment for potential lead exposure. Okay, what about C? Determine family history of developmental delay. Sure, maybe, but that's down the road, right? Advise increasing iron intake in the diet, maybe, but that's down the road when we figure out what's going on, right? So your rationale gives you a good synopsis of lead exposure. Okay, so make sure I'm not going to go through this whole rationale, but make sure you read that. But one of the things you should have picked up from your reading about lead exposure is a potential developmental delay could be an effect of lead exposure. Okay. And this has to do with, again, common childhood ailments, obesity. So the nurse notes that a child's BMI is in the 90th percentile, which intervention is appropriate. Okay, well, if it's in the 90th percentile, what should we assume?
That the child is overweight.
Right.
Child may be overweight. Okay, so A is out, right? We don't want to encourage frequent snacking, correct? We don't need to refer for an urgent medical evaluation because we have no idea if they're already working with their physician on this. Okay? Why would we recommend 100% fruit juice with and between meals? What's the problem with that?
Added more sugar.
So by process of
lot of sugar.
elimination, doesn't C make sense?
Mm-hmm.
Encourage to reduce overall screen time, because if we encourage parents to reduce, what might be a potential positive outcome of that?
That they moving around, exercising more.
Exactly.
They may go outside and play.
Exactly. And then this rationale gives you history, or gives you some information on BMIs, 90th percentile, 85th, 95th. Okay, but I want you to pay close attention to this. Rates of obesity in children have been rising steadily for a variety of reasons. Not just diet and exercise, but also environmental exposures to chemicals, pollution. Right? The consequences of childhood obesity are vast and lifelong, including increased risk for cardiovascular, respiratory, renal, menstrual, metabolic, endocrine, bone, joint, and psychological issues. Right? Obesity in children also increases the risk of bullying, which we know can be high chronic stress and contributes to more risk. Right? So with all that being said with the quiz, my question to all of you is, do you have a better understanding of some of these concepts having gone through these rationales?
Yes.
Okay. Let's see. Okay. I'm going to share my screen again, and I want to pull up week 1 PowerPoint. Let's see what we haven't covered. Okay, so your PowerPoint. Here's our 4 concepts. I think we've covered community nursing well. Okay, community-oriented nursing, we're orienting around the community or population. Community-based nursing, based in the community, we talked about that. Okay, and then public health, we mentioned, is a specialty area in community-oriented nursing, because as a public health nurse, you're focused on the community. Okay, levels of prevention. I want to bring up a good table on levels of prevention. This comes from my notes right here. Okay, let's have a look at this. This gives an excellent description of primary, secondary, and tertiary. Because in all of your, except this quiz, I think the rest of the quizzes, you will have a primary, secondary, tertiary question or questions. And on the exams is several questions on each exam about primary, secondary, and tertiary. You have to be able to know the difference between the 3. Okay, so here's the way I remember it. P is for primary. S, secondary, is for screening. T, tertiary, is for treatment. Okay, so when we think about primary levels of prevention, right, we're trying to do something to prevent a problem or an accident or an injury or a condition or a disease before it even occurs. So prevention of illness or injury, like helmet, teaching kids about helmet safety, teaching adolescents about seatbelt safety, teaching parents about the importance of immunizations. When I was in school nursing, I worked with the high school kids a lot about prevention of substance abuse, safe sex to prevent STDs, substance abuse prevention, alcohol prevention, drug prevention. What are some other examples of primary interventions that you may do in your current work environment? What are some other examples?
Hand washing.
Hand washing. Great. What else? What else?
The flu shot.
Flu shot? Okay. Yep. No.
Screenings for cancer.
Screening is secondary. We haven't got there yet,
Okay.
right? Primary, we're trying to prevent something before it happens.
Wearing
When women get
non-skid
taught,
socks to
Wearing
prevent falls.
sunscreen.
Sunscreen. What else? Go ahead,
Eating
Corey.
Wearing non-skid socks to prevent falls.
Yep.
Oh, there we
Jory, go ahead.
when people get like do self examinations like of their breasts, like women are taught that early on, would that be considered primary or would that be in screening?
Screening. That's screening.
Okay.
We're trying to prevent something before it happens.
Exercising to prevent contractures.
There you go. Okay. So primary prevention before. Go ahead.
Like wearing shoes for diabetics.
Yep. Okay, secondary screening. Okay. I also call secondary, it's right here, early identification, early intervention. We are screening for risk. Okay, because if we can early detect something, maybe we can reverse the course. Okay, so screening, maybe a mammogram, blood pressure screenings, blood sugar screenings, pap smears. With the kids in the schools, we used to screen for behavioral issues. We used to screen for suicide risk. We used to screen for obesity. Pardon me?
What about lice?
Lice. What about it?
Is that like a screening or is that like a?
Okay, so yes. So let's assume a kid comes up positive with live lice, and then we have to screen the whole class. Yeah. Yeah. We're screening for risk. Yep. Good example. Yep. What are some other what are other things that we could screen for?
Dental.
Dental. Just think of any kind of screening. Think of health
Eye
fairs.
exams.
Yeah, think of
Yeah,
health
visual
fairs. We go to health fairs
Mammogram.
to maybe have eye exams. We do preschool vision and hearing screening, school age vision and hearing screening. We're trying to screen for anything that might be a risk. Okay. And then tertiary, the key to tertiary is you need to have something. An injury has to have occurred, illness, disease, condition, because tertiary is all about management, treatment, management, right? We're trying to treat a disease to maybe reduce the symptoms, improve the quality of life. So let's take a diabetic, for example. They already have diabetes. Maybe we're working with them on how to give insulin, how to take care of diabetic foot care. Okay, so that let's say a kid has had a concussion or somebody's had a TBI. Now all the interventions are revolve around treating and managing that issue, whether it's like I said, an accident, an injury, an illness, a disease, a condition. Okay, last thing I mentioned about these three is don't think that education is only in the primary, is a primary intervention. A lot of people think that, oh, we educate to prevent. Well, actually, education is in all three levels. At the primary level, we educate to prevent. At the secondary level, we've identified a risk. So now we're educating on how to minimize that risk. Right? Let's say we've done a screening and we've identified a group of people who are at risk for obesity for whatever reason, genetic, family history. They may not be in that 90th percentile yet, but they're in the 50th. Okay, they have risk. We educate to help them reduce the course. Okay, and at tertiary, they already have something. Okay, so they already have something. So now we're educating them on how to manage that. Does that make sense? A lot of students will want to keep education just at the primary level. It's involved in all three. Okay. Okay, we already went through healthy people, 2030. Let me go back to my PowerPoint here. We talked about Healthy People 2030. Here's the goals of, this was in your, I copy and pasted this PowerPoint into your rationale for that question. Okay, vulnerability. We talked about these groups being vulnerable. Okay, children, elderly, chronically ill, American non-English speakers, veterans, homelessness. Okay. Talked about resilience. Poverty is another big factor in vulnerability. Okay, a lot of individuals, families, communities that live in poverty are considered vulnerable. Why is that? When you're living in poverty, why do you become more vulnerable? What happens? What are the increased risks?
Nutrition,
Yeah.
infection.
Yeah. Maybe access to healthcare, access to schools, access to insurance. And here's our list, our important list of the most common vulnerable populations. Migrant workers, we're going to talk about them in week 3. Okay, migrant workers and immigrants, they're considered vulnerable populations. The poor, the homeless, pregnant teens, veterans, migrants, immigrants. Oh, the one thing we didn't mention is, what about all the people in our communities with mental health issues? Very vulnerable. And then substance abusers. I went through this in my week 1 concept recording. Social determinants of health. How do we determine the health of a community, of an individual, of a family? Well, there's 5 standard determinants of health. What's the economic stability of the individual, the family, the community? What's education? What kind of education access and quality? Healthcare access and quality. What kind of neighborhood do you live in? Right? Do you live in a neighborhood that has a high crime rate, has a lot of gang activity, has a lot of violence? And then social and community context, what that refers to is, what does your community have to offer for resources? Do they have parks? Do they have walking trails? Do they have rec centers? Do they have organized sports teams for kids or adults? What's the social part of your community? How does the community engage its members to participate in social things? All these 5 things are really important as you start to assess the health of a community, right? Can you see how these 5 truly impact the health of a community? Economics, education, healthcare, neighborhood, and the social structure of the community. Okay. Questions about the week 1 content? Let's jump to week 2. We started talking about, we talked quite a bit about the school nurse. So week 2 covers school nurse, growth and development, common childhood ailments, which is what this discussion question is this week that you have due. Family nursing, family health risks. Okay, so we talked about the school nurse playing all these roles, all right? Direct caregiver, health educator, consultant, case manager, community outreach. This was in one of the rationales for your quiz questions. So what does a school nurse do with regards to primary, secondary, tertiary? Here's some examples, right? They will try and do education to prevent injuries, education to prevent substance abuse behavior, education to try and reduce the risk of disease. Primary is all about prevention. Okay. School nurse, secondary, screening for risk, early identification and early treatment. So the school nurse, as I think I said, will screen for kids at risk for obesity, kids at risk for behavioral issues, kids at risk for suicide, kids at risk for drug use. There's a lot of secondary screening that goes on in the schools. And there's a lot of early behavior that can be identified early on and treatment. Second, the most common example I did in secondary prevention is all those vision and hearing screenings for all those kids. Right? We're trying to identify any early issues with vision, any early issues with hearing to try and get that corrected before the child gets older. And then treatment prevention by the school nurse. Well, you may be caring for that complex chronic child that has a lot of needs. Okay, you're caring for diabetic students, kids with seizures, kids with shunts, kids with asthma and allergies that may have inhalers, EpiPens, kids that maybe have ADHD, and you're helping them manage that with the medication that they have in the clinic. Okay. What I simply want you to know about growth and development in infancy through adolescence, I'd like for you to know the different stages: the prenatal, the infancy, early childhood, middle and late childhood, and then adolescence. Okay, let me jump to my notes here. Hang on. I know you had to read the growth and development chapter. Think about the growth and development chapter in terms of work, and this really does go with the school nursing piece, in terms of the school nurse working with different age groups. Okay, not so much obviously not the prenatal infancy, but the early childhood, the middle and late childhood, and the adolescence. Okay, there's not a lot of growth and development that's going to be on the exam, but it's good to have a knowledge of the important parts of each of the stages. I'd like to focus on the common childhood ailments. Okay. You have little snippets of reading in your Introduction to Maternity and Peds book. Okay. And there's probably 4 to 6 pages of each childhood ailment. Okay, so I'm not going to go through each one specifically. We did have 2 quiz questions on iron deficiency anemia and lead poisoning. Okay, but please go through and read these pages on each of these ailments. All right, because there's a lot of exam questions on common childhood ailments. What I will tell you ahead of time, well, it goes through you already have seen all these: the asthma, eczema, diabetes, conjunctivitis, scabies, lice, ADHD, iron deficiency anemia, scoliosis, and lead exposure. So what I want you to have an understanding of is the basics of each one of these. A great way to get a good understanding, in addition to your reading, is follow the discussion posts this week, right? Because your discussion question this week is pick 3 common childhood ailments, right? What is it? How do you treat it? What are the signs and symptoms? And so I'll just give you this tip ahead of time. As you're studying for the exam 1 with all the common childhood ailments, yes, you have your readings, your 4 or 5 pages for each one, but read through the discussion posts of your classmates, because everybody has picked 3. And each and every one of these will get covered in your discussion posts, in the discussion thread by your teammates. So it's an excellent resource for you to prepare to learn about all of these common childhood ailments. Does that make sense? Okay, family, adulthood and the family. Okay, so adulthood, time of continuing change and growth. Young adulthood is ages 18 to 35. Middle is considered 35 to 65. Older is 65 and above. Okay, what do we know? Your lifestyle, diet, exercise, stress management, all have a major influence on your health. And we know that heredity and genetics can also contribute to your health. Okay. Obviously, in community nursing, public health nursing, we want to teach good health promotion practices, right? To encourage all age groups to stay healthy. Okay. When we talk about family nursing, okay, family is defined as a group of individuals who care for one another. There's no standard definition of a family, right? It's whatever the family says it is. Who are the caregivers, right? There's no traditional definition of a family, all right? So here are some functions of a family that are looked at across every family. All these will look different in each of the families, all right? What's the physical maintenance? Do families live in poverty? Do they not live in poverty? Are they able to provide the essentials for life? Right? What does the function of protection look like? Is there an atmosphere for health and safety? Nurturance. Are families providing loving care and guidance? Socialization. Are you interacting with family members in the community appropriately? Education. Are we teaching about the values of the world? Reproduction, recreation, support. So all these are looked at. We call these the functions of a family. And every one of these will look different in every family. And that helps determine either the function or the dysfunction of families. Okay? Failure to meet these functions leads to dysfunction. Right? We know that family health risks can come from genetics, environmental, and behavioral. Okay, genetics. We may be genetically predisposed to things like heart disease, cancer, substance abuse, alcoholism, genetic diseases. But what about the environment? Okay. Physical environment, social environment. Like I mentioned before, what if you live in a high crime neighborhood? What if you live in a neighborhood that has pollution? Or you live near a waterway and the water is not healthy? What if you live in a community that has a high poverty rate, high unemployment rate? All these things affect the functions of an individual, family, and community. What if there's discrimination going on based on race or social status? What if there's a population who are undocumented immigrants? What if there's part of the population that has low literacy or doesn't speak the primary language? What if there are communities that have limited financial resources or social resources or emotional resources? All those lead to higher risk, right? So family health risks are generated from genetic, lots of environmental risks. And what we simply mean by behavioral risk, those are your choices. Do you choose to consume alcohol? Do you choose to use drugs? Do you choose to eat poorly? Okay? They're behaviors. They're your own behaviors, your own choices. Okay? So that is an overview of week two concepts. Does that give you a little bit better understanding of each of those concepts? And again, the PowerPoints are, remember, a PowerPoint is an outline of all your readings and quiz questions, rationales. Okay? So questions. What questions do you have?
Will you do another concept recording for this week as well?
There's concept recordings for every week. You'll get those on your Saturday, hopefully Saturday. I got it out Saturday, but it was kind of late. So sorry about that. But I did get it out before the strike at midnight. It was close, but I said I'd get it on Saturday. Was up late doing it for you. And then sorry about the week one. Yes, Alexis, we can talk privately after class. Yep. I got week one out late, but I got it out. And hopefully my week one concept recording helped you on the quiz, if you watched it. And then going forward, like week two, your concept recording will be in the announcement. So going forward, there's a concept recording for every week. And the intent is for you to watch that to help you get prepared for class. Not so much to take the quiz, but the whole idea of the quiz at the beginning of the class is being prepared for class. And being prepared for class requires that you hopefully watch the concept recording. You have a look at the PowerPoint to get kind of an outline of what we're going to be covering during that week. And then your readings support the concepts that we're covering. And then once we get in, if you've done all that, you should do well on the quizzes, right? If you're preparing for class. And then once we get to class, I love to do my teaching, a lot of my teaching from the quizzes and the rationales. And then I cross cover what I didn't cover in the quizzes, and we do the rest of that teaching in more detail. That's my strategy. How does that sound? So next week, as you saw in your announcement, you'll have a second quiz, but it will be only on week 3 material. Okay, so weeks 1 and 2 are now done. Okay, so what you can do is, so you don't lose sight of that HESI prep assignment, when you have a minute this week, go back and go to your HESI prep assignment and see what you can fill in based on these first 2 weeks. Maybe not a lot, but maybe you can, there's some things in there you can fill out. Okay. And as you start to prepare for week 3, you'll get on Saturday, you'll get a concept recording, your PowerPoint, and then you have your readings. Okay, as long as you do those, you'll be prepared for class. Then hopefully during class, those concepts are then supplemented with quiz questions, quiz rationales, and lecture. Make sense? Okay, as I said, I'm mindful of time. We've got 2 minutes to spare. So how about 2 minutes of the gift of time to pull up your HESI prep and use your HESI, start filling out your HESI prep with the 2 minutes that you have. So, okay, listen, it's good to see everybody. I hope you have a good rest of the week. Let's all just keep ourselves updated about the weather. I'm sure we're going to get communications if anything's going on. But to everybody that's in the Florida area, and I know I have Pensacola students, I know I have Orange Park students, everybody stay safe, okay? Please. And it's good to see everybody. Stay on if you have any questions. And then during the week, reach out if you have any questions at all, okay? Have a good rest of the day and a good rest of the week. All right? All right.